to Pivot Point of View. I'm Destry Millsap along with Becky Pearson. Today we have Dr. Todd Caze on here with us to talk about vestibular rehab and concussions. He's an amazing expert in this field. I'm so excited. Last week we had Jimmy Joe on here telling us her story and all that she does. She's an incredible lady. Go back and listen to it if you haven't already. And we've just been lined up with incredible guests after incredible guests each week. I'm so excited. Dr. Caze, tell us a little bit about you, your experience, and your credentials.
Sure. Yeah, thanks for having me on. I'm excited to be a part of this growing podcast to kind of disseminate information related to sports medicine. So I am a sports neuropsychologist, and so it's kind of a newer field or entity. And I did my graduate degree at University of Nebraska-Lincoln, where I was immersed in sports medicine there, kind of helped start their concussion program from the ground up, so to speak, and was immersed with doing research there. And then in neuropsych, you have to do a residency in adult before you can do pediatrics. So I was at UCLA and did residency there in adult neuropsych. And then I did one of the first fellowships in pediatric concussion at Children's Health James Andrews Institute down in Dallas, Texas. And now I'm in Omaha and owner of Caze Concussion Institute. So we are a nationwide concussion company. That's what we do all day, every day is just concussion. As you know, when we first were growing up and playing sports, it was just the bell rung injury. Hey, I got one finger up. Hey, you see 3 stars, you're good. And the disservice is that there was a lack of specialization. So we saw elbow specialists, knee specialists, but we didn't necessarily see concussion specialists till recently. So now we're starting to see that emerge, and there's been some pretty cool things that we can now do because of that concentration and focus.
Absolutely. I've referred a few athletes to you and have had incredible results. If you don't know anything about concussions, they're all different, and you never know how long one's going to take versus how long the next one's going to take. And with Dr. Caze's program, he does it virtually. He'll do a virtual assessment. He'll give them their own specified exercise program for their concussion, and then help them throughout that protocol. Like, say they're a student, he'll have a return to learn protocol so they can keep up in the classroom without getting overwhelmed and overcome that brain injury. And then as they progress through those steps back to activity, which actually we've seen early return to activity. And you're the one that turned me on to that. Talk about that.
Yeah, it's always important to kind of take a step back and think about, what are some of the sociocultural factors that influence the way that we approach a mindset or a type of treatment. And the reality is that this is the only injury that has legislation around it. So imagine, if you will, if we had state legislation around ACL or knee, we probably wouldn't be having sports. And so a lot of times what happens is that our protocol has become more sacred than the actual science. And so what's interesting is, we saw really in about 2012, this broad sweeping, hey, we're going to have these protocols. We're trying to keep kids safe. We don't want them getting what's called second impact syndrome, where they get injured and then they get hit again, and they end up either being disabled or having a catastrophic injury. And now what we're seeing is like, oh no, actually, like, the pendulum has swung too far. And so the reason why I mentioned that backdrop is I always ask people, hey, when do you think the first article came out about the importance of exercise, even if they have symptoms? What that early intervention, when do you think that first came out? And most people will say, oh, well, clearly after 2012. Well, actually in 2007, we started seeing articles that were being published that said, hey, you know what? Early intervention is best. And that makes sense. We see that with people who get heart surgery. So if they get a heart surgery, it used to be, no, you just lay in your bed, you don't do anything. And now it's like, no, we actually want you moving. We want that blood flow going immediately, because that kind of helps things to accelerate. And that's what we're seeing with concussion. Now that we know it's a network disruption injury, we know that the autonomic system is really important in helping us to get better from that injury. Well, when we're working with athletes, what's their kind of best medication? What's the best way that they're regulating themselves? It's through physical activity. So now all of a sudden you tell an athlete who is naturally has that really good kind of autonomic regulation to not do anything. And we wonder why all of a sudden these concussions take forever. And we wonder why they're getting super symptomatic. And all of a sudden there starts to be a mood component or a sleep component. It's like, well, we've taken away their best form of getting the body going and kind of regulating things. And so that's really been the shift is actually the earlier the better. And what's interesting from a research standpoint is, it's taken a long time to get people just to get kids to walk the day of their injury. And we're seeing research that's even saying, like, honestly, as long as there's not a risk of contact, literally as much as they can physically handle actually accelerates recovery. And we're talking like significant days. We're not talking like, a day or two. We're talking the difference between a kid playing that Friday missing no games versus them being out several weeks.
Absolutely. And we had to change our protocol after seeing those results and reviewing the research, the more current research and things like that. I mean, it flipped our mindset completely. I mean, we went from, hey, keep them in a dark room, no stimulus, all that stuff. Well, then you're seeing kids that are getting prolonged symptoms for months at a time and having lasting effects and having a hard time coming back from stuff. And so with your approach, they're getting blood flow, they're getting to do stuff. So that makes them feel like they're on the road to recovery and actually accomplishing milestones along the way. And with your vestibular rehab, getting them back to where they know where they're at in space and actually improving their performance from that standpoint is absolutely incredible. So, Becky, you know that in this sport that we do, rodeo, rail racing, the horse industry in general, everything's unpredictable. You never know what can happen at any one time. And there's a lot of times, whether you get bucked off and hit your head or you get in a car crash or something like that. I mean, a lot of people might sustain a head injury and not even really know what to call it or what to do about it. So, Dr. Caze, can you talk about some of the number one symptoms that a person needs to look for, and then kind of talk about the process a person should take in order to get those symptoms checked out and get safely back to competition?
Yeah, absolutely. So the advantage that you have with the population that you work with is they're very in tune with who they are, and they're very in tune with their environment, and especially if they're on a horse. If you think about most athletes, and is whatever their tool is, and is an extension of who they are, and they develop a skill set to be hyper aware of that. So you see that with baseball, where the bat's an extension of what they're able to do from a performance standpoint. The horse is an extension of what you're able to do from a performance standpoint. So think about the level of integration that's necessary in order for you to be at your best and to perform at your best. You're reading the environment, you're reading what's going on with the horse, you're reading what you're internally feeling. So there's high levels of integration. And the reason why that's important when you think of a concussion, go ahead.
Absolutely. Reaction time and balance, two huge things in our sport, and two huge things that get absolutely impaired by a head injury.
Yeah. So the point in that, and I know I'm talking high level, and I'll kind of distill it pretty quickly, is that we're talking about a network disruption injury. And so if you know what networks are impacted, you're able to easily assess those. And so, like you said, that's it's your reaction time, it's your balance, and really it's more about like the things that you normally would do those all of a sudden provoke symptoms? And if they do, it's probably because you're having a difficult time integrating that information the way that you would normally integrate it.
Yes,
So if all of a
absolutely.
sudden you're horseback riding and you start to feel dizzy, you start to feel headache, and really the headache that you're interested in is it a pressure sensation? Is it behind the eyes? Is there a light sensitivity as I'm moving my eyes quickly, as I'm in that environment has more stimulus? Are those the things that are eliciting those symptoms? And if they are, then there's probably a pretty good chance that fall that you took the other day potentially resulted into a concussion.
Right. And some of the important evaluation tools that I've learned from your talks before are the VOMs. Talk about the VOMs and how you test that and what all that actually tests from a depth perception perspective and reaction time and being able to change your focus from one object to the next object. I mean, all of those things are very important. When you're a barrel racer, you have to have great reaction time, great depth perception running into that barrel so you know where your pocket is and you can be set up to be right there. And if your reaction time is slow or off, then you're going to crash a barrel. You might fall off if your horse turns too soon and you're not ready for it because you're impaired. I mean, it can be very dangerous. The same in the roping pen and especially the rough stock pen. That is a huge danger in the rough stock pen, not having that reaction time, balance, and ability to process at a high speed there. So talk about the volumes and kind of the different things you look for when checking people's eyes and seeing if they're okay there.
Yeah, the gatekeeper to that reaction time is our eyes. And so if you think about it, like the movement patterns of our eyes are really important, and as far as our ability to be able to get that information in quickly. So the VOMS is a vestibular oculomotor screener is a quick way to assess those very vital eye movements. And so our eyes help us with smooth pursuits, our ability to kind of follow a target very quickly, and stay out locked in on that target. Our saccades, our ability to jump back and forth between targets, whether it's going horizontally and vertically, and then convergence, our ability to stay locked in on something and from a depth perception standpoint and have it kind of come closer to us or stay locked in as it's moving away from us. And then finally, the ability to kind of integrate our head movement along with our eye movement is really vital as well too. And that's where the vestibular component comes in as well. And so what you're doing, and in a very simple term, the VOMS is a symptom provocation tool. So we're just trying to see, hey, if you do these very basic movements and we're able to provoke symptoms, then we know, hey, there's probably something going on because what you're doing out there, as far as and from a competition standpoint, is so much more dynamic than what we would have you do in an exam. So if the exam is a snapshot of what you're doing out there and that's provoking symptoms, then the logical next step is, well, you're going to get symptoms when you're competing as well too. And because you're used to a certain speed of integrating that information, you're actually more at risk for a more severe injury because you're not getting that information in as quickly, as evidenced by that exam.
Talk about some of those exercises that you might, because when you evaluate somebody, you see specific deficits in your evaluation, and then you give them specific exercises for their deficits. So that way they're on a clear path. It's not a shotgun approach. It is like personalized and directed to that person, that specific head injury, because they're not all the same. I mean, it's just like our rider performance program. We do an eval, we do a functional movement assessment, we tailor the program to exactly what they're doing. Your program is no different. Talk about that.
Yeah, that's exactly what it is. It's a deficit based and performance based evaluation. So we're looking at the kind of, well, I call them the big three. We're looking at oculomotor, vestibular, autonomic systems, and we're looking at, hey, where are you strong, where are you weak at, and then we have an understanding of how all of those are integrated, and then we talk about, okay, this is what we need to do in order to get you back on track. So it's a lot like an ankle sprain. So if you think about an ankle sprain, you don't do limited range of motion. You try to do as much range of motion as possible. You know, it used to be, oh, we're gonna lock it up in a boot, we're gonna elevate it, we're gonna ice it. We want limited range of motion, and now we know, hey, we want to get this thing moving as much as possible. And so, really, that's what we're looking at in our exam. Is like, hey, where are you struggling? Where is there a limited range of motion? So now let's do more so that we're quieting your environment so that you're not taxing that system too quickly. And then we give you exercises that focuses on, let's get that full range of motion. Let's get that strength back by that full range of motion. So then you can kind of go to things. And the really cool thing is it's a lot like strength training where we're looking at, hey, do we do repeated effort? Do we do dynamic effort? Do we do max effort? And that's part of the nuance in the conversations that we're having during those follow-up visits, or with someone like yourself, in the school setting with athletic trainers or physical therapists, is like, hey, okay, if you're getting stuck here, what type of training have you been doing? Okay, well, now let's do this type of training to shock the system. So there's that periodization that you would see with the performance stuff that you do as well too.
Can you give me some examples of some exercises that you might prescribe to somebody that has a head injury?
Yeah, I mean, you kind of already alluded to one of the classic ones, which is the pencil push-ups, where you're basically you're struggling to bring something in and stay locked in, and you get stuck. So then what you do is you look away, you refocus your eyes, you're able to bring it in a little bit closer. You look away, and you're trying to get it back to within that normal range with things. You can be even a little more dynamic. We use like what's called a barrel card or a Brock string as well too to kind of help with accelerating that convergence. And to your point, Dexter, when people, because a lot of times these injuries happen and there's not a healthcare provider for them, if all of a sudden they notice this very steep drop off in performance, especially in those tasks that are highly visual, that might be a good time to be assessing, like, hey, like, is it possible that I'm dealing with some symptoms of a head injury rather than just, oh, I'm off? It's very easy to kind of shrug it off, like, oh, I didn't sleep well, or I had too much fun, or I did this, or I did this, and it's like, well, wait a minute, if it's a sharp decline and it's there consistently, and also now it's even provoking some symptoms and you're getting like lightheaded or headache or dizziness, then maybe it actually is something more intense. The other thing is, to your point, um, the exercises are trying to mimic what they're doing in the real world environment. So it's a little bit of a balancing act of what we want you actually, as much as you can tolerate in your real world environment, because it's so much more dynamic than what we could even produce with the exercises. So for the athletes that you're working with and the performers that you're working with, it's really is that balancing act of like, hey, let's get you doing what you normally would do because it is so dynamic, and that would be really good for the eyes. The key might be just helping them to have a balance of like switching through what's going on. So whatever their practice regimen might be, maybe they're doing way too much time on one particular task, and maybe switching it up so that it is giving them more of that full range of motion with their eyes as a way to approach it.
Yeah, I mean the early getting people back to moving early is just so important. Becky, go ahead.
Yeah, so as I was getting ready for today's conversation, I was looking at your website, Dr. Caze, and I was really amazed about how you had laid out on your website. The earlier people can get intervention, the less they're going to delay their recovery, if you'd say. So, like, let's say we have somebody listening to this, they are middle-aged barrel racer like myself, okay? And I end up getting a concussion and I just know that I'm off. They are more likely to heal quicker if they can get an assessment from somebody like you and get a program versus waiting and just assuming it's going to resolve on its own. And so I really, if you could touch on just that part of the early intervention and how much quicker. I think you kind of did already, but I think that's a big thing is when we're in this Western industry, we're very independent people. We think we can get better on our own. And then when you have a head injury of some kind, it's not like people really can walk up to you and they see that you have a head injury. Unlike if you have a broken arm or a broken leg, it's a very big, bad injury that people can't really just walk up and tell that something's wrong. So it really depends on that person to be able to self-assess that or assess this in another person in their family or loved one that they know that they're not really being themselves. So yeah, if you could just touch a little bit on that early intervention and how much quicker you see progress, it'd be great.
Yeah, I think part of the challenge is like what happens is like when we injure our brain, because it's so much like a computer and so much about integration, the input that we're getting about, hey, something's not right is different. So like if I break my leg, you literally can't walk on your leg. You're in excruciating pain. Where when you sprain your brain, which is kind of what a concussion is for in its simplest term, you'll just get a really bad headache, and it's really easy to push through. It's really easy to kind of chalk that up to something else, but it kind of makes sense when you take more of a sports medicine approach. If that's really the crux of what the athletic training profession is it that early intervention, that triage, and we know that literally each year an athletic trainer is saving a school, hundreds of thousands of dollars because of that earlier intervention. It's just that we hadn't really thought about that before with concussion, because we were always told rest is best. Hey, we can wait this out. But now that we know, hey, it's treatable, it's something that's really easy to assess and measure, it then makes sense. Well, if it's treatable, why would you not want to start treatment even earlier? And what's really cool is I just came from a conference where we had a doctoral student do a poster with our data, and they was reviewed by blind reviewers. So you had no idea who the author was, you had no idea what hospital it came from, and it won the poster award. And all we did is we showed, when we look at early intervention, we look at number of symptoms a person reports initially, we look at modifiers like anxiety or anxiety sensitivity. When we put it all in a sophisticated formula, what matters? And the only thing that matters is how quickly you get to a specialist. And in fact, every day you get to a specialist earlier than your cohort or counterpart results in getting better a day faster. So that's the part that's really interesting and unique. And part of it is just, you have to change the stigma of like, well, that I'm vulnerable, or I'm weak because I had a head injury. And what I would say is that, if anything, it shows a lot of strength to be able to say, hey, something's not right. My brain, this is the only one I got. Like, let's do something proactive to get better. And when you do that, it results in much better results. The other thing too is, you may not even appreciate, you actually are running the risk of, for some people, this is there's financial incentives tied in with this and their performance. So you not performing at your best is actually a detriment to what you're trying to achieve, even from a financial standpoint. So, you may be potentially missing a match, or you have to forgive me on the terminology, missing an event, may actually make you more money long term, because you get back to that 100% and you're able to perform. And the next time you compete, you're actually truly at your 100% and you're able to win, versus if you're going at something at like 60%.
What other things should they look for when they suspect that themselves or someone else has a head injury and needs help?
Yeah, there's classic things that suggest, hey, you need to go to the ER, and you need to go to the ER right away. And the reason why is because you're talking about a potential skull fracture or bleed. So if you are violently throwing up after the hit, then yeah, you need to go to the ER. If you're extremely confused and disoriented, you don't know what day it is, you don't know where you are, you don't know who you are. Again, another sign of there's probably a bleed. You need to go to the ER. And then the final one is if you're violently throwing up. So it's you might throw up the first time right after the hit. That's kind of normal. But if it's constant and it doesn't take much to elicit or provoke you to throw up, then that's another indication of, hey, you need to go to the ER immediately. The challenge is, depending on what area you're in, you do have to make a decision about, am I going to go to my local provider, or am I going to seek out a specialist? And what I would say is, it probably makes sense, go ahead and follow up with your local provider. But if you start to hear some of these old ways of thinking, where they're telling you, rest is best, there's no way to treat this, they're not even confident if you for sure have a concussion, then I would say it's worth reaching out to a specialist like myself, and doing a virtual visit, and then we'll be able to tell you pretty quickly what's going on.
Yeah, I think proper recognition, first of all, and proper management are absolutely key in these situations, because when you think about rodeo and ranching in general, a lot of the time you are in a completely rural area where the nearest healthcare is maybe, it's miles and miles away. I mean, it's not right down the street. It's not within 5 minutes. It can be miles and miles away. And so, knowing those things of like, hey, we need to get somebody there quick. If they get knocked out, when you get to them, don't move them, because you don't know if they might have broke their neck or have something else going
Right.
on. I mean, just knowing those things and knowing how to process through that situation, and be able to get them the right help is crucial to their survival and getting better from that injury. So
I think what you're alluding to, which I think is vital, is like, you need to have protocols for when an injury like that happens. And the reason why is, you want to minimize risk of something more catastrophic happening, and you want to be able to rule things out. So, at times, you may go on the field and people are like, oh, this is ridiculous. Why are we doing all these things? And it's like, Well, we're doing them because the 2% of the time that there is something more severe, we're saving a life by having that protocol in place. Obviously, it's always worth reviewing and revisiting what that looks like, and are there updates and advances. But especially when you're in a setting where there's not a lot of access to a healthcare provider, it's important to have kind of that game plan in place, like you had talked about.
Yeah, and I know that you and I have been on the phone together when I'm at an event, just so we can get the quickest help possible. I mean, and having that access to you has been a complete game changer, and I'm forever grateful for it. Becky, go ahead.
So, one question that I've had, if somebody if they had a concussion years ago and maybe they still don't feel like they're quite right, is that appropriate for a referral to you as well?
Yeah, I mean, obviously it depends, right? Like as we get older, Father Time unfortunately is undefeated. So it's about knowing, hey, what's related to normal aging versus what's related to concussion. But what I will tell you is that you'd be shocked how many times we see somebody who never went through formal treatment, and you do the exam and you're like, oh, well, that kind of makes sense why you're having the symptoms that you're having. So absolutely, we've seen that happen before. We actually had an individual who had several concussions through their lifetime. No family history of wearing glasses. They didn't have a history of wearing glasses. Well, they started wearing glasses, and we start diving in, and we're looking into things, and they never had proper treatment. And so after about 8 months of intensive, home exercise program, PT, they actually didn't need glasses anymore, and they went from like having a hard time completing a 10K to being able to complete a program for a marathon. And again, it was because those upper limits is when you felt the injuries. So what can happen sometimes is with any injury, we develop a new normal. So that's probably the hard thing with your population, is that they're tough as nails. And so, it's like once I feel good enough, they maybe aren't inclined to see it all the way through. And what ends up happening is we're incredibly adaptive, and we say, oh, okay, well, 95% is good enough. Well, guess what? With your brain, like we it's not like we get to choose which settings. Like, hey, you know what? Like, can this environment just adapt so I only have to use 95% of the way my eyes move and 95% of how I want to integrate things? And so that's why you'll see sometimes you just get in certain situations and your brain's like, yeah, I don't like that. I'm getting headaches. I'm getting pressure behind my eyes. My eyes are fatiguing quickly. All of a sudden, the light's bothering me. Those sorts of things. So yeah, absolutely, it is. But I do want to just caution, like it could be related, but it could also be related to other things, and that's where we would just have to do a thorough exam and get a good history to rule those out.
Great. Well, I think it's amazing that you are able to do things virtually. And so literally anybody around the world really could do a consult with you, correct?
Yeah, yeah, absolutely. So obviously, we're limited by state laws and things like that. So there is what's called counseling SIPAC, which allows me to see people in 42 states and counting. Oklahoma and Texas are kind of probably the main ones that are relevant to you all. But really, it is kind of almost every state across the country related to that. And to your point, Becky, I think what happens is that. We don't appreciate the advancements in virtual and telemedicine, and so like we hear something like the brain and how is that possible when it's so incredibly complicated, and it's really about repetition. So if I've done virtual visits now and I've seen thousands of people virtually and I've done the VOMs 50,000 times, I'm literally looking at how fast the eyes are moving. Dusty and I have had conversations where I'll laugh at him. I'm like, that kid's getting D1 looks, aren't they? And he's like, how do you know that? Like, how are you able to tell that? Like, you're literally just looking at the eyes, and that's really what it's looking at. So it wouldn't shock me if with some of your high level elite rodeo people, I'd be like, oh yeah, that person probably does really well when they perform. They probably win quite a bit. And it's just because they're, the eyes are endless as far as the potential and possibility. And the cool thing is what we do eventually goes from rehab to performance. It's really a continuum of things, just like any other injury. Eventually, some of the things that you are doing to rehab actually probably should have been incorporating in anyways, and then it serves more as a preventative component.
I have a kid that you saw a couple of years ago that still does those eye exercises purely for performance, to help their performance. I mean, they're so bought into that, and I think that's so cool and just an absolute game changer. And like you said, I mean, you nailed it when you said it goes from a rehab thing to a performance thing pretty quickly, and those can definitely help you take your game to the next level as well. And just for the pure fact of the way that you can operate virtually, there's so many people, like we said before, when there's a head injury that happens in the middle of nowhere, they don't have access to anything. They don't know what to do, and but their livelihood is dependent upon their help. And to be able to have you as a resource to help them get back in the game quicker, get back to work quicker, get back to the ranch quicker and safer is an absolute game changer for those people. And you can be such an incredible resource. So I just think that that's absolutely amazing. And also your experience that you bring to the table as well. That's made you an incredible asset to be able to make referrals to, because like you said, you see thousands upon thousands of these kids year in and year out and do these evals all the time virtually. You can pick stuff up that the naked eye and people with not even half your training cannot do. So
Yeah, I appreciate that. One thing I would say that is pretty cool, I've worked with ranchers before, is they are really wired like our high level athletes. So, I mean, if you tell them, hey, you need to do this 3 to 5 times a day, they do it 3 to 5 times a day. And a lot of times, it doesn't really matter the setting, like the track record's the same. We average 2.3 visits. So if we see you within 24 hours, it's 2.3 visits. So usually the second visit, which is about a week later, is for the overwhelming majority of people, it's clearance. And part of it is because, we explain the why of what's going on. There's buy-in to what's going on. They do those things, and then they're able to run with it. What you're saying, which I love, which I would love to see rodeo dive into more, is the performance side of this is untapped. I guarantee you that if you really started to dive into vision training and strengthening the eyes and really pushing the limit for how fast the eyes could really move in a trainable way, like you would see some incredible things being done that probably hasn't been done in the sport before.
yes, the integration of that, the sky's the limit. And yes, you got to have a strong core. Yes, you got to have strong legs, but you also have to have absolutely quick reaction time and balance. And those eye exercises and other vestibular training can definitely give you that edge on that. Becky, do you have any other questions for Dr. Caze?
If I was able to go to your website, and I think there was a bar there that said, make an appointment. So if somebody does want to consult with you, they can visit your website, which is cazeinstitute.com. Is that correct?
Yeah, yeah, absolutely. And we're happy to always be a resource. And sometimes even just that assurance that you don't have a concussion. So sometimes being able to rule that out and say, hey, you know what, it's not concussion. You need to go follow up and get a further neck eval, or what, because of the nature of rodeo, sometimes you can impact the crystals in your ear, and that's what's contributing to the dizziness and things like that. And so be able to say, hey, you know what, it sounds like it's more like this, and this is what you can do, and you can go there. That can be really useful as well too. So yeah, I would love to be a resource for people in any ways that we can. I'm a very big stay in my lane person. So even if you're a rule and I'm like, hey, you know what, like this feels like you might have a neck break or something that just requires that in person, like we're going to get there pretty quickly, and we're going to do that. But when it comes to concussion, we're happy to be able to tell you with accuracy and confidence, this is what's going on. This is how you get better. And then it's always, I joke, everyone's favorite day is clearance day. And I'm fortunate enough that I live in a space where usually clearance day is the next visit. So that's what keeps it rewarding. That's what keeps it interesting, is the people side of things.
All right. Anything else?
That's it. I really appreciate your all's time on this. I will do a quick Google search and realize how many terms I messed up. So I apologize for not understanding the nuances of rodeo. But what I will say is I know concussion like the back of my head. So you might have to, if I see you as a patient, you might have to teach me about the nuances of rodeo and how to apply what I'm saying to that. But for my ignorance in rodeo, it's made up in my knowledge of concussion.
Well, thank you again, Dr. Caze, for coming on here. I really appreciate your time. I know you're a very busy man and you do so well for your patients. So thank you for sharing your time with us today. And I'll close it out with make your health the pivot point to your success. Thank you all for listening.